So the last policy call that we had, we did talk about bill introduction period. We talked about hearings. We are right now in the midst of hearings. The month of February has been hearings up the wazoo. We've had a ton of hearings because there have been so many bills introduced that impact children and families. Once the month of March hits, though, you will start seeing some movement towards the next stages of debate. So March 13th, again, is the deadline for a speaker priority bill designation. March 14th is the deadline for committee and senator priority bill designations. March 28th is the final date for public hearings. And then March 31st is the first day of full floor debate. So our hope is that we will be able to provide you updates, not just through these policy calls, but through our legislative watch list page. We have the legislative watch list page on our website, and it does provide an update and a description on all the bills that we are focused on. For folks, again, just awareness, we will be having these policy calls every 2 weeks. So our next one will be February 25th. We will have them in the afternoon and the evenings for those who can't make it. All right, I will hand it over to my colleague Katie to discuss the bills and the child care subsidy.
Good afternoon, everyone. We do have several pieces of legislation related to the child care subsidy program. Today, I have updates on a couple of those bills that have had some movement in the last few weeks since we spoke last. The first one is LB 95. And LB 95, as a reminder, creates a pilot program under the child care subsidy program to allow employees in the child care field to access subsidy for the care of their own children. This bill is actually scheduled for hearing tomorrow at 1:30 p.m. in the Health and Human Services Committee of the legislature. So let's all cross our fingers that we have good weather for tomorrow. The bill also, just before this call, received its fiscal note, which is something we'll talk about today. This is the projections of how much implementing a piece of legislation will cost the state. The fiscal note for LB 95 is quite complicated and does not give a single number. It gives estimates that range anywhere from $1 to $2 million up to over $40 million. So I anticipate that tomorrow's hearing will be focused largely on trying to grasp what that fiscal note means and implies and how to manage that. So that is where we are on LB 95, and we'll be able to talk about what happens at that hearing during our next policy call. LB 304 eliminates the sunset of the income expansion for child care subsidy in Nebraska. So as most of you know, the child care subsidy income eligibility in Nebraska was 130% of the federal poverty level, so among the lowest in the nation. It was temporarily expanded to 185% of the federal poverty level with a sunset clause. LB 304 would eliminate that sunset and make 185% of the federal poverty level our permanent income eligibility range. The hearing for LB 304 was last week. It was on February 6th, again at the Health and Human Services Committee. This bill had an excellent hearing. In addition to First Five Nebraska, we heard from child care providers. We heard from the state chamber, which actually represented over a dozen local chambers throughout Nebraska. We heard from child care programs and other advocacy organizations about the importance of the child care subsidy as a workforce support. Again, I'm going to come back to fiscal note. The expected impact to the state for LB 304 was originally estimated at $14 million per year for the 2 years that the state is required to provide an estimate. We did work with the fiscal office and they reduced that estimate to $10 million in the second year. However, much like I expect with LB 95, the majority of the hearing was spent trying to understand what the cost to the state will be, both currently, right now, and into the future, especially when we consider that in conjunction with the required federal changes that will ultimately increase reimbursement rates for providers, but increased reimbursement rates we know means additional costs to the state. So the hearing was really well received, but there are some lingering questions about how this program will be paid for on a continuous basis. The next bill that had a hearing the very same day, immediately following LB 304, we had a hearing for LB 339. And LB 339 would require the Department of Health and Human Services to provide each provider who bills through the child care subsidy program an end-of-year summary report of their billings that aligns with the school readiness tax credit non-refundable application. This bill was received well by the members of the Health and Human Services Committee. It is something that they saw as an important step for both the tax credit and just general accountability for the child care subsidy program. There was some confusion as the Department of Health and Human Services interpreted the bill to mean they would provide a single report to the legislature, not a report to every single provider. So that we are working with Senator Hallstrom on some amendment language to clarify, and we do anticipate that the department will then increase the fiscal impact of this particular bill. And I believe that is it for me. And so I will hand this over to my colleague, Mitch Clark.
Thank you, Katie. The first bill I will touch on is LB 51. This bill is one that we wrote a letter in support, and it has moved to the second stage of the process. What it does is sign Nebraska onto the National Crime Prevention and Privacy Compact. This makes the background check process more efficient and facilitates federal and interstate background checks, specifically the federal fingerprint-based segment of the process. It has a positive fiscal note, and we anticipate it will keep moving. The second bill is LB 363, which would adopt the Apprenticeship Grant Act. This bill would establish an apprenticeship grant program for individuals on economic assistance, which would include early childhood apprentices who qualify for the program. Next slide, please. LB 248, we had submitted a letter last week. This bill would exempt programs which are licensed by the Department of Defense for early childhood programs that are on base. It would exempt them from state licensing requirements since these programs are already licensed under the Department of Defense. LB 274 is a bill that I testified in the neutral capacity last week. This bill increases the required coverage amount for liability insurance for providers from the current $100,000 per occurrence to $200,000 per occurrence, and also some enforcement provisions for complying with liability insurance requirements. LB 162 is a bill that had a hearing on January 29th. and we testified in support for this bill. This would establish the Child Care Safety and Security Act, which provides for grants to communities to establish emergency response protocols and establishing the needed partnerships among participating entities in that community, similar to the Standard Response Protocol Program operated by the Lincoln Littles here in Lincoln. LB 457 is a bill which would require schools and early childhood programs to establish anaphylaxis policies. The bill stipulates that the Department of Health and Human Services and the Department of Education create model policies for early childhood programs if they would like to use such model policy. LB 670 is a bill that we testified in opposition last week. This bill would reduce the in-service training requirements for early childhood programs from the current 12 hours per year, 12 clock hours per year, to 4 hours for early childhood programs licensed by the Department of Health and Human Services. And it would reduce the in-service training requirements for pre-kindergarten programs that are school-based from the current 15 hours to 4 hours. And I will hand this over to Elizabeth.
Thanks, Mitch. The next one, LB 74 would allow those individuals that are on public duty, if they are a campaign, running their campaigns, running for public office, to be able to use some of their campaign funds to pay for childcare expenses if they incur it while they are performing their official duties. This bill had its hearing on February 6th, and it had a very small fiscal note. I'm not sure what the likelihood of this bill getting passed is. This bill has been brought up a couple of times, but there is general support for it. People understand that even as elected officials, they cannot afford quality care. And so providing those support and resources, especially for those mothers who have young children at home, would open it up so that more folks can represent their communities at the legislature. LB 94 would allow those individuals who are trying to continue their education by getting a digital skills certification to use some of that funding for childcare purposes. So again, the hope is that this bill would support those individuals wanting to move up with their economic assistance and help their families by continuing their education or job training. This bill also did not have a high fiscal note. It was a couple $100,000 for both fiscal years. The hearing was on February 3rd, and we submitted a letter in support. LB 161 had its hearing yesterday in the Education Committee. We testified in support. This specific bill was around changing the pre-K student formula weight from 0.6 to 1.0. First by Nebraska normally likes to take the position around supporting those pre-K students because, as we know, the cost of care should not be limited based on the age that you are. So for us, increasing the weight so that more of those kids, again, could get the resources they need in the setting that they decide upon is what we would support. So this one, again, it's for those pre-K students. It would change it from a 0.6 to a 1.0. So giving those school districts more additional resources. The next one, 182, has actually moved along the process pretty quickly. This bill advanced from select file on February 7th. This bill moved quickly because it had no fiscal note. This bill had two components to it. The childcare sections are the ones that we were interested in. It would allow those banks, financial institutions, and insurance companies to access the non-refundable credit of the Child Care Tax Credit Act. It will be again reported out and on final reading, hopefully soon, and get passed and signed by the governor quickly. So as you can see, based on this trend, right, is the bills that do not have high fiscal notes are going to move fast, especially prior to the budget discussion. After the budget discussion, hopefully we'll see some bills move with funding, but until that point, you probably won't see anything with large fiscal notes get passed. The next one is a bill that we will come in opposition to. So LB 264 is the governor's cash fund bill, right? So he introduces, the speaker at the request of the governor, introduces a series of budget bills. This one specifically looks at the cash funds in Nebraska. This does remove $3.25 million from the Early Childhood Endowment Fund, which funds sixpence. We will oppose this and hopefully be working with the appropriation members to make sure that this budget line stays intact. The cash fund itself, right? So the sixpence receives $7.5 million from the general fund every single year. So this bill doesn't touch that. But what it does touch is the money that's specifically in the cash fund. Our concern is truthfully that if we are setting a precedent for taking funding out of the cash fund for sixpence, it would potentially open it up to be rated in the future. We know that sixpence is a instrumental initiative here in Nebraska, impacting birth to 3 children who are at most at risk for falling developmentally behind. So for us, this will be something that you might see us asking for letters in opposition. You will probably see us asking for folks to contact their senators on it. But JR will be reaching out to provide more of that information in the future. The next one that I'll just mention, we didn't discuss last time, but is the Department of Education budget request. So every year, agencies come before the legislature to discuss their budget requests. Their budget requests might differ from the governor's budget request. And for us, it was important to come in on the Department of Education's because they did, for the first time, request funding for what's called the Early Childhood Integrated Data System, or EKIDS. We have worked with partners at the department and private and other local nonprofit organizations to try to get some sort of universal shared data system that both the Department of Education, Department of Health and Human Services could use to support our birth to 5 system. But right now, we've sort of hit a roadblock in making any sort of progress. Our hope was that the governor would include this budget request in his, but he has not. So we will be coming in support of the Department of Education's and emphasize why a shared data system is so crucial to the system. And I'll hand it over to Sarah.
Hi, everybody. Good afternoon. I'm Sarah Howard. I'm a policy advisor at First 5 Nebraska. I'm going to go through our bills that are related to maternal and infant health. So we'll start with home visiting. It was a big week for home visiting. So I'll start with LB 22. LB 22 is Senator Dungan's bill to allow evidence-based nurse home visiting to bill Medicaid. And it advanced just last week from the Health and Human Services Committee unanimously, and it was debated on the floor just yesterday. The conversation on the floor of the legislature for LB 22 really did revolve around the fiscal note, alongside the importance of this program for new mothers and young families. The issue with the fiscal note, and not to get too wonky, but it actually billed the service to the child's Medicaid coverage at a 55% match instead of the mother's coverage at a 90% federal match. And so the committee did adopt an amendment to clarify how to bill this service. LB 22 was ultimately advanced to the next round of debate, select file, with 43 votes for on the floor out of 49 and 0 against, and a commitment from Senator Dungan to work on an amendment around the fiscal impact before the next round of debate. It was really exciting. The next home visiting bill is LB 104. That's Senator Raybould's bill to adopt the Family Home Visitation Act. This bill defines home visiting in statute and calls for an annual report to the legislature for 3 years. So from 2026 to 2028. This bill had a hearing in the HHS committee last Friday. We received a $0 fiscal note, which is the dream for policy advisors, like Katie, Mitch, and Elizabeth and I. And shout out to any PLA alums who are on this call. We were able to bring in 2 to come testify, Des Brandt from the Panhandle and Haley Crumley from Columbus, and they did an awesome job advocating for home visiting. We are very hopeful that this bill will advance from committee. Okay, next slide. We also have movement on 2 other bills. So LB 41 is Senator Reepe's bill to update our prenatal screening statutes for pregnant women. This is because of the rising rate of congenital syphilis in the state of Nebraska, or babies being born already infected with syphilis. Our current statute calls for 1 screen at the first prenatal visit, and this bill would update to best practices to include 2 additional screens, 1 in the 3rd trimester and 1 at delivery. This bill was debated on the floor yesterday, and it did advance to the next round of debate, select file, with 46 votes for and 0 against. Before the next round of debate, we may see an amendment that clarifies the patient education component of the screens, but I'm very optimistic about this bill now that it's advanced to select file with such a beautiful vote. The other bill that I'll mention around maternal and child health specifically is LB 446. This is Senator Gareka's bill that allows a statewide quality improvement collaborative access to health data, such as vital records. This bill also codifies the state's vital statistics dashboard, and allows researchers to have an application process to access state-level data. This bill now has a hearing scheduled in the Health and Human Services Committee on February 27th. So we are busy getting ready for that. Next slide, please. And the last thing I'll put on your radar is LB 224, Senator Gareka's bill to require paid maternity leave for state employees. And that's a guarantee of 12 weeks. Has a hearing scheduled in the Government, Military, and Veterans Affairs Committee on February 21st. So we'll be getting ready for that hearing as well. And with that, I will pass it on to Mike Medwick.
Hello, everyone. My name is Michael Medwick. I help coordinate public awareness activities for the School Readiness Tax Credit and the Child Care Tax Credit. Just a quick update to give you an idea of where things stand. As you may know, the amount of money that the state reserves for each credit is capped at a certain amount for each year. And as you can see from this table, we're rapidly approaching the caps for the tax credit applications submitted for the 2024 tax year. The Nebraska Department of Revenue reports out on how much money has been requested and reserved for each tax credit and updates those numbers every few days on their website. I'll pop the URLs, the hyperlinks for on web pages into the chat here in just a moment, so you can bookmark them for yourself and keep an eye on them. But as you can see, we're really breathing on the especially for the child care tax credit refundable for parents and the school readiness tax credits, we're just about at, we're very close to the limits on those. So the key message here is that there's a limited amount of time left for Nebraskans to submit their tax credit applications. They are processed by the Department of Revenue in the order in which they're received on a first come, first served basis. And one of the more especially urgent deadlines coming up will be on March 1st, which is the deadline for childcare programs and providers to submit their applications for the school readiness tax credit to the Department of Revenue. Now, what happens after the tax credit monies have been used up or fully claimed, or after tax day, is we're going to be collecting stories from folks who have taken advantage of the tax credits, so we can find out what difference it made in their lives and the lives of the children they serve, the families they serve, their own families, or the communities in which they live. So be prepared to see some communications coming out from First Five Nebraska, asking for folks all across the state to weigh in on what the tax credits have meant to them. It's important that we tell these stories because we very much want to see these credits stick around year after year after year. And one of the best ways of doing that is by letting policymakers and decision makers in the state know that the credits are valued and being taken advantage of the way they were meant to. So with that, I will say if you have any questions, feel free to pop them into the chat or reach out to me directly.
Thanks, Mike. So we normally don't have a slide on the tax credit, but because the application window is closing, we are trying to use any source or any really avenue we can to tell folks that they need to submit their applications if they haven't done so already. I would then like to hand it over to JR. If you do have an interest in advocacy or getting more involved in bills, JR, who is the grassroots and outreach advisor here at First Five Nebraska, handles all of our advocacy efforts. So if you have any additional questions, here's her email, but also I'd like to hand it over to her to offer a few words.
Thank you. Before we move on, there are two quick questions in the chat. Adela was asking, what can we do to get the insurance companies to accept us and not be so expensive? They've raised their premiums a lot. And Lou's actually asked a question very similar. She wanted to know what we recommend to do since the insurance companies no longer want to cover those who work 24/7. I don't know if anyone wants to take those questions.
I can take it. In general, opening those lines of communication with your insurance companies to help educate them on the importance of the program that you're operating and how it works. Insurance companies do not work in childcare like you, so I think it's really important for advocacy to be communicating with your insurance company. But beyond that, we know that oftentimes providers run into roadblocks even with their best efforts. That's why it's also important, I think, to find advocates that care about these issues who may have some know-how in the insurance space. And I know that there are a couple in Nebraska that are really engaged in early childhood advocacy issues who work in the insurance industry that could be a helpful resource for you. I hope that helps a little.
Unfortunately, and I'll just add to that, Mitch, unfortunately, right now, we have not been able to find a legislative fix to some of the insurance concerns that have been brought forward by providers. We have introduced interim studies to look at the issue more closely. The members at the legislature know that it's an issue. It's an issue across the country, though, too. So for us, we're also looking towards our national partners and other states to see who is approaching it differently and to see if we can replicate a model here. Right now, no one is leading the charge really, or has the best solution outside of what Mitch offered, where engaging that insurance provider and talking to them one-on-one about what you do and explaining to them in more detail about why your coverage might not, why you need that coverage and about how much you can pay for premiums. All of that is important. So again, I would encourage you to engage your insurance providers and have those conversations. But if you are continuing to hit roadblocks, that's where you can reach out to JR, and she'll be able to again help connect us or be able to provide you additional resources.
Yeah, Shannon asked that. How do they get in contact with the underwriters to make the decisions? And I am happy to help you all connect with some of the experts that we've been working on that have been really diving into this and are really experts on the way liability insurance impacts childcare. They tend to be brokers, but they know the inside game and can give us a lot of feedback and some expertise and insights, point us in the right direction. I wish there were better answers for you right now, friends, but we're going to be staying true to this road. So as we wrap up, I want to encourage you. Your civic engagement is going to be very important right now. There are quite a few childcare bills, and we want them to stay a priority for our legislators. So we hope you'll sign on for the alerts for these key times to submit a letter or to contact your senator. But I also want to invite you to join in the advocacy efforts that go beyond civic engagement and writing to your senator. If you're interested, please do out to me. I would love to bring you into our group that's doing this work. And I can tell you more at that point, particularly if you are in a district or an area where there are advocates doing really good work. I would love to connect you, but please reach out. That is it for me.
Thanks, JR. So I'm going to look through the questions in chat. So right now we'll open it up to questions. If you have any that you would like to put in chat, or if you would like to get off mute and just speak them directly into your mic, you can do that as well.
Elizabeth, if you'd like, I can answer Michelle's question.
Yes,
So
that'd be great.
Michelle asked how about where we are on the vast discrepancy between subsidy payments for rural areas compared to urban areas. That is an excellent question, Michelle. Last year, we did pass LB 904, which does allow the department to utilize a different methodology for setting subsidy rates. And kind of addresses some of those. Ultimately, what we hope it does is address some of those urban and rural differences. What I can tell you is that there was no difference in the most recent subsidy state plan that has come out. They stayed true to the differences. However, we do have a new survey coming out soon. It will come out in this year. And this will be our first opportunity to see how the department utilizes those legislative changes made in LB 904 so that we can see what sort of advocacy efforts need to come next. And we're watching that very closely at First Five, especially around those urban-rural differences.
One quick thing, Elizabeth, I am going to go ahead and drop in the chat an interest form for anyone that might want to join in the advocacy efforts, because as Katie mentioned and Elizabeth, there's quite a bit we're going to want to coordinate as things move forward.
Yeah, and I see a question from Stacy Schulten about hoping the legislature understands the conflicting messages of supporting LB 264 while also supporting the home visitation and maternal and child health bills. I think this is one of those moments where I'm really grateful that an organization like First Five exists, because I am very sure that they do not realize what they're doing in 264 around sixpence. And so this is an opportunity for us to provide some additional education to the legislature about the importance of sixpence and the work that they're doing. Because I think it's a very big bill. And so our small piece of it is something that's incredibly important to families. And so it's our job to make sure that they have an awareness of that.
Stacy, we do have some great advocacy efforts started around this, around educating around sixpence, but also engaging the legislature. So will you send me an email and I will get you involved in that process and that group?
Kim, I noticed that you asked if the legislature's website is slow. The answer is yes. It is very slow. It's been very slow for this whole session. So if you're having trouble submitting online comment, keep at it. It might just take a second to refresh.
This is Michelle. I just wanted to, first of all, say thank you. I know how hard you guys work um, for all of us and stick up for us on behalf of the child care and advocacy. Um, as far as the discrepancy in subsidy, where that's really affecting us is as the minimum wage goes up, like to 13.50, anybody who has infants, it's a 4-to-1 ratio, which I totally agree with. But at $13.50 an hour to pay, which is very little, I get that. But I can't even pay my employee $13.50 an hour plus the taxes plus the insurance. There, I mean, there's nothing. We're upside down for any infants we bring in to a facility. So how do you stay in business and take in infants, which is kind of the care that's needed to start them in even in the daycare when you can't afford to do it?
Yeah, I wish we had an answer for you, Michelle. Um, we know how much we know that this is such a struggle, right? Especially combating the impact that the minimum wage, will have on childcare providers, and caring for infants, like you said, is the most expensive. The only thing that we can do, First Five Nebraska, again, that's why we exist, is to make sure that those concerns are addressed and that we talk to the state senators and also our federal delegation to make sure that they are aware of the struggles that you go through. Um, but just know that this is constantly on our mind. And this is one of the biggest issues and concerns that we have is how are we going to help support these childcare programs as this minimum wage continues to impact their ongoing operations. I don't have a solution now, but that is something that we are, again, continuing to work at.
Yeah, and I appreciate everything you guys do. I know how hard you do work, so it's definitely not for lack of trying. I'm just not sure what else to do because as daycare providers keep closing, we just opened in Cass County, not realizing that how much we would be losing opening in like literally 8 miles from somebody, from Sarpy County. We could have chosen Sarpy County. We didn't. We wanted to support Cass, and we're losing hundreds of thousands. I mean, it's thousands of dollars in subsidy programs because we're 8 miles south of Sarpy County, which is totally ridiculous. So anything I can do to help, we've already sent letters out to our senators across the board. I'll forward one to you that we sent out. But I'm not sure what else we can do. It's just, how long can you stay in business when you can't even break even? So thank you.
Any other questions before we log off? All right. Well, thanks everyone again for joining us today. Like our next one again, if you attend the afternoon sessions, will be February 25th. Please let us know in the meantime if you have any additional questions. Have a great day.